Why do I ask the question, have they had your wisdom teeth pulled? Because that's actually normal in the Western world. I would say at least 80% of all teenagers get them pulled because we grow too narrow and have no space for our wisdom teeth anymore. The problem is the surgeon will only inform you about the surgery and the pain meds and how to treat with swelling and everything. But you will never be prepared for that surgery, meaning you're as a teenager going into a surgery unprepared, usually lack of nutrients, critical lack of vitamins like vitamin D3 and critical minerals like magnesium, zinc, boron. In teenage years leaves a huge trauma. You're not prepared for the trauma. So basically the host is the problem. You're in hibernation mode, you're in shock, you're in stress mode, your body won't heal. It's just not able to heal. That's why a lot of patients develop dry sockets. It's just a nasty part of like ongoing antibiotics, and it just really doesn't heal. And over time, the gum heals on top of it, but the bone never really fully recovers and turns into something called ischemic bone disease, or in layman's terms, called cavitations. This is something you do not learn as a dentist in university. Chronic inflammation in the jawbone is the same principle. Chronic inflammation is the trigger to all sorts of chronic diseases.